Good morning, ladies and gentlemen. I am Dr. Annie. I am the Chief Hospital Administrator of Care Hospitals, Surat, Gujarat. Care Hospital is a group of chain of hospitals led by Dr. V. Somaraju, and our headquarters in Hyderabad, and our Chief Mentor is ex-President of India, Dr. APJ Abdul Kalam. Dr. Krishna Reddy is the CEO and Mr. Kashiraj is our COO. With salute to our leaders, let me talk about my topic. India's public healthcare network is 6 decades old. It is plagued by many problems like absenteeism of doctors, lack of proper facilities, and most significantly, lack of proper reference services to urban hospitals and specialist centers. Due to these reasons, the utilization and confidence in the public healthcare system is very low. Successive governments have tried various measures to improve the system with marginal success. Application of ICT tools will improve access and delivery of healthcare services to India's vast majority of poor people living in rural areas. India started building its primary healthcare infrastructure way back in 1952 as a part of the Community Development Program, much before it formally accepted the Alma Ata Declaration of Health for All to the primary care approach. The main stress of the national health policy as adopted by the Indian Parliament in 1983 is the provision of preventive, promotive and rehabilitative health services to the people, thus representing a shift from Medicare to healthcare and from urban to rural population. Since 74% of the Indian population lives in the villages, the delivery of health services to rural masses holds the key and forms an integral part of the socio-economic development. In essence, the prime objective is the provision of universally acceptable and affordable healthcare to communities. ICT initiatives in health and population sector. There are interesting initiatives in the application of ICT in healthcare in India, and a review of some projects is presented here for a broader appreciation of march of ICT in India. You can see how the ICT helps in medicine. It is in terms of patient records, medical equipments, expert systems, web-based diagnosis, research, communication, etc. Research. ICT has changed the way in which medical research is conducted. Modeling the effects of new drugs, ICT is used to conduct clinical trials, collaboration between international teams, example, Human Genome Project. Expert systems, also called knowledge-based systems, they are computer programs that attempt to replicate the performance of a human expert on some specialized reasoning task, store and manipulate knowledge so that they can help the user to solve a problem or make a decision. Expert systems are being used for disease diagnosis. Communications. Teleconferencing has been used to share expertise. Surgeons in one country can help those in the other. Wireless transmission provides a link between hospitals and doctors. Telecommunications helps. Remote diagnosis can be used to diagnose and treat patients remotely. Patients can monitor their own conditions at home without need for a visit in a hospital. ICT support caregivers are major in information training, working conditions, health and well-being, that is peer support, private life social integration, language learning, cultural knowledge, quality of care through communication, coordination, and collaboration. Visions of future ICT. Some of the visions of future ICT enabled the healthcare system before turning to an analysis of the implications of what is currently happening, that is the reality, and what might realistically be expected to happen over the next 5 to 10 years. Roshi in 1998 anticipated that the convergence of media, computing and communications will create a wide healthcare market in which information availability and connectivity is vastly increased. In their view, this convergence would result in 4 interrelated changes in healthcare: more activist consumers, better informed care, providers lower cost care delivery, and more efficient healthcare administration. Flower in 1999 anticipated clinical assistance, expert systems that will enable physicians to provide just-in-time knowledge, clinicians connected to each other, enabling them to better care for their patients, electronic medical records and evidence-based medicine, increasing the amount of science in the craft of medicine, thus reducing mistakes and increasing accountability. Imaging, which by combining a variety of techniques will allow virtual reality and 3-dimensional viewing of the body and its part from inside. Robotics, with everything from delivery cards and security to surgery being conducted or assisted by robots. Enterprise management through the more effective collection, manipulation, display, and use of information about all aspects of the healthcare system. Medical information available to the public through the web, and tight links between the consumer and the system, allowing for day-to-day, low-intensity contact, shown to be both effective in terms of health outcomes and efficient in terms of cost savings in the management of chronic diseases. In 1998, the UK National Health Services (NHS) commissioned Health Smart 2010, a tale of life, death, and healthcare in the information age. Noted that the overall consensus of our research was optimism, that the IT revolution does offer ways to deliver healthcare more widely, more efficiently than today. Information technology is changing the relationship between health services and the people who use them. The availability of hard facts will shift the balance of power between doctor and patient, changing the practice of medicine in the ways that are hard to predict. This is what the vision for future made a decade back, where the IT controls every systems, every activities of the healthcare. So let us see what is reality. We can talk many things through IT, but how come it affects the human technology in practical way? Healthcare is widely seen as an information-intensive business. It is one of the more complex product systems in our economy. Nevertheless, healthcare has been likened to a cottage industry awaiting full industrialization. Goldsmith noted that it would be inaccurate to describe most healthcare organizations as enterprises. What they really are in collections of professions, loosely and uncomfortably housed in the same physical structures. As a consequence, systemic innovations are adopted very slowly. Passive resistance to change in the compounded by a corrosive suspicion produced by the failure of past IT applications to materially improve productivity or processes of care. Clinical Decision Support Systems, otherwise CDSs. 4 key functions of electronic CDSs are routined in administrative, that is, supporting clinical coding and documentation, authorization of procedures and referrals. Second, managing clinical complicity and details, keeping patients on research and chemotherapy protocols, tracking orders, referrals follow-up, and preventive care. Cost control, monitoring medication errors, orders, avoiding duplicate or unnecessary tests. Decision support, supporting clinical diagnosis and treatment plan processes, and promoting use of best practices, condition-specific guidelines, and population-based management. Technical issues in the automation of clinical information. It is not easy to implement ICT in the healthcare as we are dealing with human bodies. Automation of clinical information lies at the heart of all the systems that attempt to automate clinical activities and or integrate administrative and clinical activities within and across the various kinds of stakeholder organizations. The most promising ICT applications depend upon the automation of patient records, but it is here that process is lost, largely because of the barriers of standardization and concerns about security and privacy of patient data and about the uses to which it might be put by some stakeholder organizations. Major technical issues are privacy, standardization, financial requirements, human factors, regularization of CDSs. When we talk about privacy, there is a difficult balance to be struck between the privacy interest of the patients and the advantages of using detailed clinical information in a variety of managed and evidence-based applications. The demands for both security and widespread availability of medical records in a variety of institutional settings make the automation of clinical information extremely difficult. Second, we go to standardization. The lack of commonly accepted definitions and nomenclature for the collection and coding of clinical data and of standards for the exchange of health information. Financial requirements need much greater investment in IT and in user skills that has occurred to date. Human factors considers the ability and willingness of health workers to adapt, learn new skills, and divert attention away from their direct healthcare activities during the transitional phase, which may involve them in loss of revenue. The availability and willingness of health workers to form new relationships within the health systems, fear of being underdetermined and are replaced by the new technology, and the willingness of the patients to participate in what to some seems likely to be a somewhat dehumanized healthcare system. Regularization of CDS software, whether it is necessary to regulate clinical software systems in the same way as the medical instruments, as if so, exactly how to do it. The diagnoses are made on the basis of CDSs, then their fitness for use should meet minimum standards in exactly the same way that the medical equipments and supplies have to meet certain requirements. Behind this, there are many social issues. Who is to control prescriptions and admissions, procurement, logistics and payment systems, and information gateways and content, and demands to balance professional and commercial interest. The healthcare system stakeholders have different core interests. Public hospitals are spurred on by the growing need to really understand the cost of health consumables and avoid waste. Private hospitals, in order to stay in business and function effectively, need to find ways of saving money and re-establishing a profit margin in an environment where revenue is stagnant and costs are increasing. The health funds are also searching for ways to reduce operating costs and look to e-commerce using industry standards as a better way of dealing with claims. ICTs are almost always seen as a cost saver, but it is often the business process changes enabled or forced through the application of ICTs and the contributions that ICTs make to improve the quality of products and services that are more important. and it is almost always the social and structural aspects of the change process that are overlooked in favor of a technological focus. Healthcare is no different. While much has been documented about the problems in exchanging information in the current paper-based environment, it needs to be acknowledged the information technologies are not in themselves solutions but enablers. Technical approaches alone will not achieve better information management. The organizational and cultural aspects of how information is currently exchanged, the barriers to exchange, and the clinical information needs of both consumers and providers at the point of care must be addressed before such technologies can be effectively used to improve the management of clinical information. In Indian hospitals, the application of ICT-enabled information management systems to Indian healthcare is extremely difficult. The healthcare sector's fragmented constituencies and complex transactions present a major challenge. It is too early to write off the potential impact of ICTs as mere hype, but it is clear and progress is slow and there are many barriers to overcome. Consequently, at the system level, the impacts of ICTs are likely to be in overall management and cost control and influencing decisions at the point of care. In terms of care, the impacts are likely to be in such areas as quality control, patient safety, and general improvements in outcomes and performance. The impacts at the point of care. Clinical tools hold more promise than do others, both in terms of direct efficiency and cost savings in terms of influencing doctors' behaviors. It is this latter that is likely to see major players in the healthcare system driving the adoption of e-health and especially of clinical tools because they impact so directly on prescription practices and thereby upon the choice of drugs and management of drug expenditures and on referral of pathology, diagnostic, specialist and hospital services. Money is tied to doctors' signatures. They authorize the treatment and everything else that happens to citizens who are ill. A government which can control doctors' signatures can control cost. A corporation which controls doctors can make a profit. Other professionals who can wrest control of treatment from doctors can increase control over their own activities. IT growth. When you see the Indian scenario, today India has 11 million citizens in the high income segment, 58 million in the middle income segment and 1090 million in the low income group. If India's GDP continues to grow at 7% a year, in 2020 the number of citizens in the high income segment will rise to 52 million and in the middle income segment to 372 million. The number of households in the low-income group will drop to 933 million. As a result, India has the potential to add around 4 million citizens every year to high-income segment and some 26 million citizens every year to the middle-income segment up to 2020. ICT-enabled solutions in healthcare, education, financial services, and public services can drive socio-economic inclusion of 30 million citizens each year faster, cheaper, and more effectively than the traditional models. There are a lot of benefits of ICTs. So, coming into conclusion, how information technology and information management influence the behavior of both doctors and patients at the point of care is critical. Longer term, the major challenge for healthcare may be surveying the transformation to an individualized care paradigm and adopting strategies to cope with the transformation and thrive in the emerging environment. ICTs in the form of both information systems and information management will play an important role in enabling stakeholders throughout the healthcare system to adjust and prosper. Understanding the potentials of ICT to transform cost and control structures is essential for those seeking to benefit from the changes through containing healthcare costs, enabling enhanced health outcomes in Indian hospitals. Thank you.